If you are looking for twins, do you want to conceive twins? This is the best video for you. Stay with me till the end. If you watched my live stream last time, we talked about definition of twins. We also talked about monozygotic twins, that is identical twins, or the one we call look-alike twin. And also we discussed about dizygotic twins, that is non-identical twins or so-called fraternal twins. But today I want to tell you a very nice thing that you will like. Factors that are linked to twin pregnancy. 6 most important that if you follow, twinning till the end. Enjoy this video with me, and if you like it, hit the red button written subscribe, turn on the bell for more videos that I will post. Let's go and let's do it. First factor is family history of twin. First of all, we should remember that monozygotic twin, or what we call the look-alike twin, does not run into the families. And this is spontaneous, and mostly there is no factors that are linked to a woman giving birth to identical twins that has been done in terms of research and has been known. It is only known for fraternal or non-look-alike twins. Now, family history of twins is very important if in terms of if you want to conceive a twin, you must be a twin yourself on the side of women or ladies, but not on the side of men. Men only carry that genetical code to their daughters, and their daughters, if they get that genetical code of giving birth to twins, is when they are able to give birth to twins. But not that if you marry a man who is a twin, then it's likely that you are going to give birth to a twin. No, that has not been scientifically proven. So family history of twin is key. And also, if you are a twin yourself, that one, if you are a lady and you are carrying that genetics code of having been a twin. Note that when you are a man and you are a twin. So that is the first factor that may link you to have twin pregnancy. Number 2 is age. Age is very important, and it has been realized that those who are 35 years and above, and those who are in late 30s, they are prone to release mature ovum, 2 of them at a time, and it has been linked to giving birth to twins. So if you want twins, you can be waiting for your late 30s. And also remember, late 30s also, when I talked about infertility, watch that video that appears up here about infertility. I talked, one of the risk factors of infertility is age 30 and above. But 30 and above has been proven also that it is linked to twin pregnancy. Height and weight has been linked to twin pregnancy. Those people who normally have BMI of 30, that I'm talking about women having BMI of 30, and tall women are prone to have twin. But take care that you should not be over obese. You should not be eating. This is a natural physique. We can't make our height to be tall. So it is not stereotyping. You must understand this is how God created you. But don't overeat so that you become obese, that you want to have twins. Diet is also very important factor, and this has been proven by scientists who took a research in Nigeria, tribe called Yoruba. They are the most leading people in the world with highest incidence of twin rate. And they found that there is a special type of food they eat, that is the yam, If you watch Nigerian movies, you will say, I would like to get pounded yam. This yam has what we call dietary estrogens, and if they eat this, they have high chances of releasing two eggs, and this one can lead to fraternal twins. In fact, I saw this type of yams being advertised in Amazon. So if you have your phone, just go to Amazon and order your yam, and twin pregnancy is on the way. Fertility drugs are also very important in this scenario of having twin pregnancy. One of the drugs that we normally use is clomiphene or clomid, coming into a pack of 30s or 10, 50 milligram each, that a woman normally take daily or as prescribed by the clinical officer or nurse or a doctor. And this drug is normally causing a woman to ovulate. And how does it work? It normally sensitizes the anterior pituitary gland to produce follicular stimulating hormone and luteinizing hormone, and this one eventually act on the ovaries to enable the development and maturation of follicles and also ovulation. And in this process, two eggs might be released, and two different sperms fertilizing these two different eggs, resulting to fraternal twins or non-identical twins. And this is very, very important. If you take clomid or clomiphene citrate, it is very, very important that you might be pregnant with twins. And remember, this drug you should not take while you are pregnant, and it should only be prescribed by a qualified medical practitioner. And it is not bought over the counter. You can't just go over the counter and buy it, because we must give you this drug when we are sure that you are not pregnant, you don't have any ovarian masses, ovarian tumors, or even cervical cancer, and also your liver functions are 100%. So this drug is very, very important in making you to be pregnant with twins. So clomiphene citrate or clomid is very, very important in this scenario. When you take clomiphene citrate, you have about 80% of ovulation and 50% of giving birth to twins. So see how much is it is very important in this scenario of giving birth to twins. Gonadotrophin injectables are also important in terms of twinning, and this one is given via injection, either intramuscular or subcutaneous, and this one must be given in a health facility that is qualified to offer fertility treatment. And it is also very important that it has 30% chances that you might conceive and get twins. So drugs like clomiphene citrate and gonadotrophin, the one in the market known as gonadone hef, is very, very important. ART is very, very important assisted reproductive technology like in vitro fertilization, that is IVF, whereby a mature egg plus sperms are combined together in the lab and then implanted into the woman uterus, and this scenario can result into, they can decide to plant two ovum, resulting into twins, fraternal majorly. Or they can also do artificial insemination, that is called intrauterine insemination of the semen, which is being passed to the uterus with a tube, and this can result into twin pregnancy. And mostly they normally use drugs to enable this process to go on very well. For example, of the gonadotrophins that we have little scientific evidence, like taking of folic acid. We know folic acid is very, very important, and it normally prevents neural tube defects like spina bifida and women should be taking this. And of course, we normally offer this during antenatal care. So there are little evidence about this. Also, taking of dairy products have been proved very little that women who are able to take dairy product, there's some type of insulin that normally cause hypersensitization in the ovaries, causing ovulation, that normally helps you, and this can result into twins. Also, there's a little research on breastfeeding, getting pregnant while you are breastfeeding, but little is known about this. And also, there are myths and conceptions about getting twin pregnancy. For example, sex style. Whichever sex style you use, there will be no pregnancy resulting in twin, or even taking herbal medication, dosing your vagina with vinegar, or washing your vagina with citric acid. I don't know. I think citric acid is very corrosive. Comment in the sections below other myths and misconceptions about giving birth to twins, even doing sex when you are on your menses. It's quite weird. Comment there if there's any scientific evidence of myths and misconceptions about twin pregnancy. Thank you for watching. Thank you for watching, and if you have not subscribed to this channel, hit the bell down, return subscribe, and turn it on for more videos that I will post. And also comment in any video that you will like family vlogs to talk about. Muchas gracias.